Welcome back from the break, everyone. Thank you for sticking with us through this episode of Independent Thought. So, at the end of our first segment, we were speaking about climate change. And, specifically, I was referring to what happened, back in the end of August, like we are recording this, like at the tail end of Hurricane Ida right now, but you're going to be hearing this episode in October. So, a little bit of time discrepancy here, but I wanted to note that one of the stories that came up when that hurricane hits was the fact that so many hospitals were just unable to move patients because of there's just so many beds being filled up. And the healthcare industry has seen quite a hit over the past year due to the pandemic. And it is such an unfortunate thing that people have to deal with during this time, having to be in and out of the hospital for various reasons. But it kind of like comes back full circle for me, thinking about not just the devastation that we've seen because of the pandemic, but the cost that people accrue when they do have to go to the hospital.
Yeah.
Medical bankruptcies are still the number one reason for bankruptcy in our country. That is a conversation that does not get talked about enough for me and personally. You have told me that you believe in Medicare for all. So I would like to ask you, why do you support it? And how do you think it would help? Because there are still so many people out there who do not believe that the government should be involved in our healthcare. They just think that if they are, it's going to be a worse experience for people. Do you feel differently? And tell me why.
Yes, I absolutely feel differently. I know differently. And I know that even that line of thought is decades of intentional misinformation campaigns that have been successful. I don't know if anybody, either you, Desmond, or anybody that's listening is familiar with Wendell Potter, but he is a former healthcare executive that has, since he left the industry, has spent his entire time. He did stuff with Michael Moore and other things. He's now written books and articles about and just laying bare and calling out that these have all been intentional tactics to make sure that the healthcare insurance companies stay in power and get the most money at the cost and expense of people. And so I 100% feel differently. And I think that what we need to start doing is having intentional conversations. And so I'm so glad that you're doing this with your platform and that it's being discussed a lot more. Real quick, let's just start with what's happening with Ida and the hospitals there not being able to evacuate. And also a lot of people, especially, and I can't stand this when I see this on either side, any of the aisle, whether you're a moderate, conservative, extremist, saying that, well, these people should have left or they should have evacuated and it's their fault that they're suffering because they didn't leave. And between economic inability to leave, not everybody has the money to go rent a hotel room somewhere. If they can't leave their jobs, they can't just pick up and go. And that is also what ties into the what's happening with the hospital there. They are understaffed, underfunded, and there are fewer hospitals than should be because they've all shut down to consolidate into massive for-profit hospitals instead of the local community hospitals that there should be, because those don't make any money. And so there's not enough places to put these people. These hospitals wouldn't be overburdened if we didn't have such medical deserts all over this country where there's only one hospital. So one hospital might be serving an entire county of 8,000 people, or 800,000 people rather. How are they going to service that? How? And so the numbers just don't add up. And then, the upkeep, the generators failing, different things, there are hospitals that would be able to maintain with these power outages, but they don't have the right infrastructure as far as their generators and their service equipment to stay open. So there's just a lot of compound issues there that would all be mitigated by Medicare for All, because Medicare for All elevates everybody from the independent gig worker all the way up to the corporations and the small business owners and the corporations. So from workers to employers, it helps everybody by removing the costs that we all deal with on a day-to-day basis. I personally spend over $100 a month just to have healthcare, and I still spend $130 just to get my medications, and I only have 2 of them. That's with insurance. I spend $130 a month on my medications. So, and I'm a veteran, so, and I don't have access. I have a specific situation where I do have access to VA healthcare because I'm a disabled veteran, but that is another misnomer, is that veterans automatically get healthcare, and they do not. So for anybody out there who styles themselves a patriot or a supporter of our troops and wants to support our veterans, the best thing you can do to support our veterans is advocate for Medicare for All, because it mentally unburdens them, it physically and financially unburdens them from having to take care of their family's healthcare. There's a candidate running in Southern California, the disabled vet, and she has to spend $800 a month for COBRA for her husband and daughter to have insurance because her disability is doesn't cover them.
Right.
So Medicare for All would not be, here's the biggest misnomer, going back to your question, is people think that the government shouldn't be involved in our healthcare. And I couldn't agree more that they shouldn't be involved in the healthcare. The difference is that they wouldn't. The largest lie that I hear is that if the government takes over our healthcare, your doctor's office is going to turn into your DMV. Not true. Your doctor's office is going to stay your doctor's office. What's going to change is after you get seen and your doctor takes the paperwork to the back to his billing department that he needs 30 of instead of one, he needs 30 different billing clerks so that he can make sure that they have all the information that they need for the hundreds of different insurance companies, policies, premiums, and different variations of their different coding, because each insurance company has its own level of coding. And so you need staff that can work on all those different insurance companies for whatever you're willing to accept. So that right there, when the doctor stops seeing you and turns around and starts handling the administrative, the clerical, and the financial aspects of his business, that is when the government takes over, because then he needs one clerk. There's one sheet of billing to cover everything. And now there does need to be a discussion about who sets the prices, because I do not believe it should be the government sets the prices. They are not healthcare professionals. They do not know what these services cost to provide. So I do think that the doctors need to be involved and at the table for setting these costs. But once that is set, there will be one standard list that every doctor can refer to. This is what is billed, no matter what patient you are, no matter what state you're in, no matter what your financial status is. This is the same code. He needs one person, maybe two or three to understand that, depending on how busy his office is, and then he submits it. The change isn't in your provider. The change is in the pay to your provider. And so that's why it's called single payer healthcare. Now, Medicare for All is one of those things. It's one of those slogans. It's catchy, it pops, people somewhat understand it. But even with Medicare for All, it's a misnomer. And there's a huge portion of the elderly population who is against Medicare for All because they are under the misconception that it will be exactly like their Medicare that they have right now, where there's Part A, Part B, Part C, Part D. Some states opted out of certain parts. And even with all of that, you then need extra insurance to cover your prescriptions because they don't cover that. And you need another insurance to cover your long-term care because Medicare doesn't cover that as it stands now. And that's the problem with the statement Medicare for All. I 100% support it. The bill, there's actually some tweaks that I would do to the current Medicare for All legislation, but I would 100% vote for that in a heartbeat. And that is going to be the number one thing. As soon as I'm sworn in, I'm going to turn around and say, when are we voting on this? How do we make this happen? I don't have time for your photo op. I'm here to get legislation done now. This Medicare for All is decades too late. We've got, Nancy Pelosi said she's got signs from the 1970s in her basement. Maybe the problem is that you put them in your basement and you're not still fighting for it. Maybe that's why we don't have it. So it's been too long coming. This has been discussed. I mean, even Nixon and Reagan were for different parts of the thing that we're fighting for right now. So they don't agree with 100% as we have it now. But even Republican presidents and governors were for this decades ago. So the fact that we are still arguing and squabbling about it now is absolutely ridiculous. So it would be not government provided healthcare. It would be government paid for healthcare. Your doctor would still see you. And you know what? The biggest thing is, another big argument is it removes choice. I want the freedom to choose my own doctor. Well, we don't have that now. I don't know what kind of insurance you have, Desmond, or whatever anybody has that's listening, but every time I've had insurance my entire life, even through the VA, you're given a list of people you can pick from to go see. Might not be the closest doctor to you. It might not be the doctor you want. It might not be the doctor you used to see on your old insurance. Your company changed, your insurance changed for whatever reason. You no longer get to choose to still see your doctor. The only freedom you have is to now be forced to choose another off of some insurance provided list. And so that is the main thing that Medicare will completely eliminate, besides cost, is barriers to doctors, procedures, and providers, because then the patient will get to choose who they want to treat them based off the level of care they get. And then those doctors will actually be able to provide better care because they're not forced to double and triple book time slots in case people don't show up. So they still meet their quotas. So the insurance company still pays them.
Okay.
And
Okay.
so one thing is, how are we going to make this happen? Right here, this sign behind me, CalCare. I don't know if anybody knows the history of how Canada got their national healthcare system, but it went province by province. This was not a national movement that won overnight. What happened in Canada was they went province by province. And so that's what we're doing here in California. California is going to lead the way to national healthcare through CalCare. There's legislation put up right now. It's called AB 1400. Anybody listening in the state of California, AB 1400 will be reintroduced to the House Assembly in January. It was already introduced. They got the question they always got, how are you going to pay for it? And there was so much backlash from the assembly members that the authors of the bill didn't put the financing in there, even though none of our legislation comes with financing to start with. They put up the legislation, you agree to fight for it, you're going to vote for it. Now let's figure out how to pay for it. Just like the national fight for healthcare, the first thing they bring out is how you're going to pay for it. We don't want more taxes. We're already paying too much in gas, blah, 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 blah. We can't pay for it. So they tabled the bill and it's being reintroduced in January. And we have been, ever since this last January it was introduced, I've already done two rallies here in our county, our Ventura County. There were statewide day of actions in February and in April that we participated here in our county to raise awareness for CalCare and to tell everybody and to teach everybody that this is how we are going to achieve national health care. So even if you live in a different state, if you have the opportunity to spread awareness or advocate for CalCare, please do so. It's in our entire nation's best interest to get it passed here in California, because once it's passed here in California, which is we are one of the country's largest economies standing on our own, we can do it here. We can roll it out state by state and get it passed nationally.
Okay. So that is a that is a very ambitious goal. And I hope that it can help, because truthfully, what really needs to be addressed is the fact that our current healthcare system is essentially it's broken. And so any kind of legislation that is aiming to enhance it or change it or, replace it that, is trying to be better, I'm all for that. And another policy that we've heard of, I guess, like more recently with the reconciliation bill, and then, even previously in Democratic primaries, where people talking about making education at the higher levels, tuition free. So we hear about that, currently in the reconciliation bill, where they're aiming to do 2 years of free community college. Bernie, when he was running, he was talking about having 4 years of tuition free college paid for. I noticed that on your platform that you have Education for All as one of your pillars. Could you tell me a little bit about what exactly that looks like? Like, how would that be implemented, and what the legislation say?
Absolutely. So it would be a variety of legislation, probably, because it would need to be rolled out differently state by state. That is one thing that a lot of people don't understand, is that if you put out federal legislation, they believe that, again, it's removing choice and it's telling the states what to do. Where I believe the federal government has an obligation to set a national standard that no state can go below. And I think that is where we have gotten lost, is that we have, just left states to their own devices, and whether they have the money, the ability, or the desire to improve their education in those places, they don't, for a variety of reasons. And so there are things that the federal government can do to help and set a bar and a bare minimum that all states have to perform and provide at this level. And then it would be up to the states to implement it as best it would in their locations. I think that in universal pre-K, which is in the current reconciliation bill, I think that's amazing and huge. I think we absolutely need universal pre-K. I think we also need universal school lunches. The stories that have been coming out recently of, children being turned away, lunch ladies having to take food off of children's trays because they are in lunch debts. I mean, what are we doing? What are we doing? And the argument that I've heard against that is that feeding these children is spoiling them.
Oh, I saw that out of Wisconsin.
We have a problem. We have a We have a crisis of heart and conscience in this country when we believe that feeding children is spoiling them. It's just, we're lost, and we need to get back on track and focus on what really matters, the people. And these children, they can't learn properly if they're hungry, if they don't have a good home environment, because the parents are worried about their healthcare, worried about bills, worried about getting evicted right now. Millions and millions of our people are facing eviction right now because our entire Senate and House of Congress has absolutely failed us. They have let this happen. They knew it was going to they knew that Joe Biden's extension was going to get challenged and thrown out by the Supreme Court. They knew it, and they did nothing. We knew that it was going to expire July 31st, and they did nothing. And that's not what we're talking about. But the failures of our government are affecting us at absolutely every level. And so children should have the ability to go to school and not worry about their lunch debt, their school debt, any type of thing like that. So from universal pre-K all the way up to high school, absolutely universal public college or universal public education, 100% free. Where it gets dicey is there are for-profit colleges. And so those, we absolutely cannot tell them what to do. We can't roll into Harvard and say, you've got to have tuition free. You just can't do that. What we do have is state universities and state community colleges that are either locally funded or funded through the state. And that is where we can really make a difference, is making all of these public community colleges and universities tuition free. But that's not even far enough to me. When I was in school here at our local, I went to our local community college, Oxnard College, got my AA and transferred to our local Cal State University, Channel Islands. And so I know how important these local community colleges are for low-income people. These schools are making a huge difference in people's lives and the access that they have to an education. We are breaking generational curses through an education and uplifting and breaking the poverty ceiling that has kept so many of us down because of a lack of education. But it's not always about higher education. It's not just about getting a bachelor's degree, because I have a bachelor's degree. And when I graduated with it, I was lucky to get a job as a supervisor at Starbucks. Let's just be real. So it's not just about a bachelor's degree. It's not just about getting a degree in communications just to get through and go through the marks or do this and do that. What we also need to do is expand access and make it 100% free at the community colleges, especially trade schools. Our community college system here is really cool. We have 3 different community colleges that you can go to throughout the county. Once you're enrolled in one, you can take classes at all 3. There's a connected system. That doesn't exist everywhere. And so that's why I say we will have to address each on a state level to see what their programs are to work with them. But these community colleges, because they're in different areas, they're able to break up. So one school, the school here at Oxnard that I went to, it's got an auto program and it's got a dental hygiene program to get people that don't want to go get a degree in certain things. They want to get into dentistry or they want to get into auto shop. They want to make a living with their hands. We have the culinary school there as well. Then you go to the Ventura campus and there's a firefighting school and there's a nursing program. And I can't remember off the top of my head, but Moore Park has specific ones too. The students that are going to the community colleges, we get financial aid. And if you're a California resident, we have a wonderful program here. It's called the Pell Grant. And it's, I'd have to go back into the details, but basically if you're a certain income, they 100% cover your community college tuition. And that's super awesome. What happens is if you're enrolled in the auto program or in the dental hygiene program or in the medical assistant program, you don't get federal financial aid. They're at the same campus as me, seeing some of the same professors, going through some of the same programs. They do not have access to federal financial aid. It's not recognized. And so not only do we need to do public community colleges, public universities, we need to also make sure that we are funding trade schools and adult schools, because we also have a lot of people who didn't go get their higher education or who didn't even finish their high school diploma because they had to go get a job, because we're working people. And like me, they started working at 14, 13 years old. That's when I started working, was 14 years old. I had my first hourly wage job. Number one, that affects your ability to get your education because you've got to work so that you can eat at home. Number two, you can't even, when something happens to your family, there's a loss of income. A parent gets terminally ill because they got diabetes and they had to have their leg amputated because they couldn't get preventative care. And now they can't work. You now have to drop out of high school and go take care of your family. So adult schools also need to be federally funded because those people are just seeking a second chance at life because of whatever decisions they had to make to stay afloat and keep their families fed. So I don't even think public universities and colleges is enough. We need to include trade schools and adult schools as well.
Okay. All right. And that is something that I think that most people should believe in, because I think, too often when we're hearing these conversations about college, we are hearing people say like, well, oh, maybe not everyone wants to go to college, or, well, people can't even use their college degree. So I feel as though what you're talking about right now is kind of touching every like aspect of this spectrum versus just solely focusing on just, 4-year universities as we currently think about them. So I do appreciate that, but kind of as we're closing out this episode here, one of the last things I want to ask you is actually a question that you touched on at the very beginning. You were talking about the fact that so many people feel, I guess, like disinterested in politics right now. You were saying that you want to like re-energize voters. There is a lot of distrust in the government right now. You're seeing that with vaccine hesitancy, for instance. People do not trust that the government has their best interests at heart. And this is something that's felt on both sides, but I would say on one side more than the other. And the question that I have for you, as someone who is not just running to represent Ventura County or state of California, but the entire like people's house, what role do you feel like you have to play in order to help people believe in government again, that it can actually be a positive force in our lives?
Follow through on what I'm talking about, because I feel that I'm already fighting for and advocating for the things that would make the changes in these people's lives. And you're absolutely right that there's not only have we been neglected for so long and been misled for so long by our politicians and our government, but to the point where, and this is something here locally that we are dealing with, to where now when you as the government come in and try and help, this is what's happening here in our local community of Oxnard, who is a low-income community. It is a community of color. It is a largely Spanish-speaking community, and they have been neglected for so long that now when you come in and you're showing them, hey, we're going to repair this public park. We want to upgrade your infrastructure. We want to improve the pipes because we know that these pipes are poisoning you. They say, no, I don't want anything to do with you. Don't come into my neighborhood. You're only fixing it so that I'll leave because I won't be able to afford to stay here anymore. And then other white people can move in. There's such a distrust of so you're absolutely right. This is not, and these are working people. This is not red or blue. This is an issue of our working class people being neglected. The status quo has never worked for working people. And we're just finally waking up to that not only is it not working, but that there is a different option. And I hope to be an example and a representation of that. No matter what happens in my race, win, lose, or draw, I will be responsible for showing our community here that they deserve the help from our government and that the government is here to help you. That is one of the largest misnomers I have heard. One of the scariest statements you can hear is, I'm from the government and I'm here to help, right? I don't know if you've heard that, but it's not wrong. There's a fear when people say things like that for a reason, because for too long, it has been to these communities' disadvantage. Right here, right outside of LA, they did a documentary on it called Boyle Heights, which is fantastic, about this community called Boyle Heights. It's a low-income community of color where they bulldozed through their neighborhood to build part of when we had the huge infrastructure boom with the highway and the interstate boom with the highway system. They paved right through these people's neighborhoods and didn't even bother to put off ramps so that this would bring economic benefit, tourist, community, people coming in. It drives right through and gets you off at the next stop 2 towns down. And so not only are these schools, communities, and neighborhoods now dealing with the pollution, the exhaust from the traffic and all of that, but they've actually suffered economically because they are no longer as viable because it's harder to get to them off of the highway. And so these people are not wrong in their fear of the government and what people are typically trying to do, because it's not usually for them. It's usually something they're doing to them or at their expense or in exploitation of them. And so I think that the first thing I can do is what I've done and choose to run nonpartisan and advocate 100% for the people every time, everything I'm saying, everywhere I'm going. And backing that up by who I am or am not taking money from. 100% grassroots, people powered, no corporate money, no corporate lobbyists, no fossil fuel money. I will take money from the workers in these industries. And that is an important distinction that needs to be made. I will take money from nurses. I will take money from miners. I will take money from coal workers. I will take money from any working person, from any person that wants to give me money, as long as you are not a billionaire, as long as you do not own some executive. Anybody that has that level of money and power has typically no interest in what the people need, because they've already got everything they need. They don't even know how much a banana costs or how we go grocery shopping, how we feed ourselves. It just doesn't even make any sense to them. And so, I've heard backlash, especially towards Cori Bush and some other people, that we don't have experience. If you've been almost homeless, if you've had to decide about paying your rent or feeding your family, then how can you serve in Congress? And I think that those are the people that need to serve in Congress, because unless you've had to decide if you're gonna feed your kids or pay that medical bill or keep the lights on or pay your rent so that you can buy Christmas presents for your children, you don't really know what it's like to struggle and what these people have been through and what we do to survive, and how little things like healthcare, like a guaranteed education, like an increased living minimum wage that is tied to the cost of, or that is tied to productivity, and that so that it's guaranteed to go up, so that we don't have to have this living wage fight every decade, because it hasn't gone up since, I think it's been over a decade since our
2009.
living wage. There we go. So, and 2009, incidentally, so 2008, the economy collapsed. 2009 is when I joined the Navy, and I was, before that, working a job making $8 an hour, and it was the most money I'd ever made in my life. And it was absolutely legal. And I'm, working at the federal tipped minimum wage of $2.75 an hour. The fact that these are still legally on the books as okay is disgusting. And I know you didn't ask me anything about this, but that is a whole nother discussion that we could have about wages as well. So just advocating for the people, walking the walk when you talk it. I'm going through and I'm signing pledges on who I'm going to take money from, who I'm not, who I'm going to work with, the things that I support, and showing the people that running nonpartisan is the most democratic thing that you can do and the most representative thing that you can do, because nothing stands between you and the people and what they need.
I love it. If someone wants to get more involved with your campaign, find out more about you, where can they find you online?
Absolutely. Thank you for that. So I've had it down at the bottom of the screen for anybody watching, but votefordaniel.com is my website. Again, that is votefordaniel.com. And then on there, you can go to my contribution link at the top right. Top left are my social media links to Twitter and Instagram. My handles at both are Daniel FORVC. Daniel FORVC is both my Twitter and my Instagram handle. You can sign up on my website for my email list and stay tuned for events. We're going to be going canvassing and reaching out to the communities and doing a lot of public events. We do community care events every last Sunday of every month. So take hot plates to people in need, and a lot of other community engagement that we could really use your support in. And as always, we are grassroots and people powered. So any dollars that you can afford to contribute to our fight for better, we greatly appreciate it.
Thank you so much for coming on the podcast today and sharing your platform with us. I really do appreciate that. Everyone, if you are interested, those links that were just referenced will be down in the episode description. So go ahead and just click into the episode description and you will see those links that we were just talking about. Daniel, thank you again for coming through and for telling us, what exactly your plan is for the country. As California goes ahead and, finally figures out what district you're in, I will then update that on the episode as well. So it'll be like district, whatever the number is, maybe This will be 26. So, all right, everyone. Thank you for sticking with us through this episode. We have one final break that we're going to take, and we'll be right back with my final thoughts of the day. Stay tuned.